I'd like to introduce our director, Stephen T. Barron, who is the director of the Department of Mental Health. Under his leadership, we have made great strides, particularly in the area of children's services. We now have a well-functioning system of care for youth, and we are also providing specific prevention activities to prevent suicide among our young people. Without further ado, I'd like to present to you Stephen T. Barron, Director, Department of Mental Health.
Thank you, Barbara. I also want to acknowledge the work of Julie Grummett, Robert Price, Marie Morales-Black, Barbara Parks, and all who have contributed greatly to this conference. This is a tremendous turnout, and to really recognize a very, very important public health issue. There's probably no more important public health issue than preventing suicide. So I'm thrilled with this turnout. In a minute, I get the pleasure of introducing the mayor, but Mr. Mayor, we are just thrilled to have you with us too. It just highlights the importance and the significance of this conference. Just want to spend 2 minutes before I introduce the mayor and I'm sure this is in your packet and the good work that I didn't purposely, I inadvertently left out Dr. Bazran. All this happens under Barbara's leadership and oversight, so we're very grateful for the whole team that really has contributed so much. But this grant was received in '09, and we're near the end of a 3-year grant that's been tremendously significant, particularly on providing screening of youth, training adult gatekeepers. I think we've trained about 1,000 people to really recognize the early signs of suicide. And it ties into a number of things the department's doing, particularly with a new initiative called Mental Health First Aid. There's a lot of synergy between a number of these public health initiatives, and I think for the first time we're getting involved with the really good work on prevention side. So this is really feeds into that, and partnering with community-based organizations. A number will be recognized at lunchtime, and we are thrilled with their participation. But that being said, and I'm delighted to be here. It's actually my pleasure and my job here to introduce my boss, Mayor Gray, who I am. I'm so thrilled to be part of the administration and the progress we're making. But what makes it, Mayor Gray is just not here as a disconnected public official in this issue. He's lived this issue. He always tells a story. We met 35 years ago. I think it was 40. We both are, but he was running the ARC of D.C., always committed to vulnerable populations after getting a bachelor's degree. And I think what really put him in touch with this issue was his work at Covenant House. I can just imagine the frequent times you had to deal with at-risk youth and suicidal issues at Covenant House. So this is a mayor who's very, very connected to these issues. And even more important, when I get a chance to be with the mayor, particularly at cabinet meetings, what you really feel is this sincere desire that we all commit and interact with the district residents in a very humane, meaningful way, and not just blow people off, but we got to connect with people. And in your work, in all of our work at suicide prevention, there's nothing more powerful than our ability to connect. And the mayor takes this at the top and moves it down through whatever we're doing, be it a public works issue or a human service issue. So I am so thrilled to be part of this administration that's making so much progress, and it's my pleasure to introduce Mayor Gray.
Good morning. I want to first of all thank Steve Barron for such a nice introduction. it certainly is nice to be described as not a disconnected public official. And I suppose we have some of those, and I'm delighted not to be one of those. I think coming to this experience at the point in life that I did gave me an opportunity to have a lot of substantive experiences around what life means living in a complex city like the District of Columbia. I want to start also by thanking Steve Barron for a career of extraordinary service. He is somebody who I've known for a long time, as he indicated. He had a very successful career involved in the mental health field in Baltimore, and we were successful enough to be able to get him to come to the District of Columbia. And you need only look at the accomplishments of what he has done during his time here to recognize what an extraordinary professional he is. I want to say, too, how delighted I am with what happened earlier this week, and that was in the U.S. District Court. There was a major milestone achieved, a major step forward, and that is the apparent coming to a close of perhaps the longest case in the history of the world. And that is and that, of course, is the Dixon case, which had an incredibly worthy purpose, and that is, or has an incredibly worthy purpose, and that is improving mental health outcomes for people who are at risk or may in fact have one or another kind of mental illness. At the time that case began, we had a hospital that had literally thousands of patients being housed there, and really no significant community system at all. Certainly, clearly, the pharmacology has improved over time, which has made life more manageable for a lot of people. But really, the thinking was that if somebody had a significant mental health problem, they needed to be in a hospital setting. And we had the hospital setting right here in the District of Columbia, and that was the St. Elizabeth's Hospital, which at the time, some of you well know, was run by the federal government. In fact, it was, interestingly enough, considered to be the premier hospital in the nation, and was oftentimes pointed to as the way mental health practice was addressed in the in the nation. And some of the innovations, I'm not going to go through all of those, but actually I have a clinical psychology background, so I'm sort of in my territory a little bit. Certainly helps in this job, I tell you. But some of the innovations in mental health have been attributed to what went on at St. Elizabeth's Hospital. You look at some of them, they're absolutely barbaric. Prefrontal lobotomies, and some of the things that went on. But we have come a mighty distance. We're having thousands of patients housed at St. Elizabeth's Hospital on both sides of the avenue is now passé. We have a contemporary facility, a hospital that I think on any given day doesn't house more than about 300 people at this stage, which means that we now have developed a significant and continue to improve upon a robust community system, which is where people ought to be. Because if people are going to overcome those stresses in life and those factors that lead them to decompensate and become a disconnected person from society, they have to be able to continue to be connected with those things in their life. So we hope by next February that we will have demonstrated, have taken those final steps that will lead us to being able to be extricated from this case. I think it was filed in 1974. How many years is that? 37? 37 years ago. I mean, some people's careers don't even last that long. Yeah, right. There are people in this audience, Steve, who are not that old. So again, I want to congratulate Steve, but I also want to congratulate everybody in this room. He couldn't do this by himself. This has been done because a system of community care has been developed. A system, by the way, that I think is now being looked at nationally as symbolic of how we provide, how we provide mental health services to people in an urban area and being emulated across the country. So Let me join you in applauding all of you for what you've done to make this happen. I appreciate Steve talking about the fact that children are incredibly important in my life. I've spent a lot of time working with children. And one of the things that I promised as mayor is that we would work on those things that we thought would improve outcomes for children. We're working now in a very significant way on education reform in the city. We know, and it's not just us in the District of Columbia, every public education system in the nation has been challenged. It hasn't done the job that it should do, and that's why, if you don't know it, the United States is now 29th or 30th on a list of nations in terms of the effectiveness of its public education system. And frankly, the effectiveness of public education has a material impact on how young people feel about themselves, whether they feel they have to get to the threshold of possibly taking their own lives. So I have spent a lot of time on it, and I will continue to as long as I'm mayor and as long as I'm professionally engaged working to improve our public education system. One of the things that I'm proud of that I frankly think contributes to young people being able to feel good about themselves is an investment in an early childhood education system. When I was the chair of the council, one of the things I said was, I don't understand. And maybe you all could answer. We got professionals in this room, got lots of them actually. But maybe you all could help me understand, why is it that children start school at 5 years of age? That's the answer that I've gotten everywhere I've asked that question. And that is no answer. And the reason that I asked the question is that many of you know 90% of brain development takes place by the time a child is 5 years old. So that we may have already lost the battle by the time a child gets to be 5. And frankly, some of the issues of self-esteem, some of the issues, just simply put, of how children feel about themselves, those opportunities already may have been lost by the time a child gets to school. So I invested myself in helping to develop legislation that created a commitment, which sounded odd, sounded crazy at the time. I'm sure you all understand that term, right? Sounded as if it was an unattainable goal, and that is to be able to ensure that every child who's 3 and 4 years old in the District of Columbia has access to a DC public school, a charter school, or a community-based organization. And frankly, we said we'd do it by 2014. Well, in point of fact, by just about a year ago, it had become so popular that we actually had achieved creating a seat for every 3 and 4 year old in the District of Columbia. We are the first city in America to be able to do that, and I know it is contributing to the mental health of our young people at that stage. One of the things that I want to do now is frankly move to infants and toddlers, and I think we both know, Steve, that is going to contribute also to the health and wellness of our children, especially the psychological health and wellness of our children, because they will learn at an earlier stage how to engage with other people. They will learn that they can accomplish. They will start to, quote unquote, feel good about themselves, because that is one of the things that substantially underlies young people who find themselves at the threshold of suicide. As a matter of fact, I said to a group not long ago that if I could get a fetus into a program, I would do that. And the reason is, and of course we do, we have something called prenatal care, right, Phyllis? We have prenatal care. So we're going to continue to attack the front end of this problem, because I think it will contribute mightily to the difficulty that we have with young people who may entertain the possibility of suicide. Young people grow up with a lot of stress in their lives. I had a conversation with a friend just a few days ago, whose daughter just went to junior high school. And he was complaining about the fact, he says, well, she's now in another school. She wants me to get her to school much earlier than she has to be there. She's afraid that she's concerned that she's not going to get from her locker to her class. And he said he discovered that the classroom was about 50 feet from the locker. And he says, doesn't have enough time. He said, I timed it myself, and I realized it was only a couple of minutes. She thinks it's 15 minutes. And I said to him, I said, do you know what's going on there? I said, she's afraid. She's scared to death. She has moved from the protected environment of an elementary school where you don't even have to change classes to now being with all of these new people, all of these people who she just met, these people who go from one class to another, and a lot of times you don't have the same people in your class. She's now in an environment that is anxiety producing for her, and being able to get through that is going to be one of the most important moments in her life. And I have to tell you, this person is a great dad. He is a fantastic dad. And I think he is going to be just a support system that she needs after he gets through his concern about whether it's 5 minutes or 15 minutes to get from, because we all know that's not the issue, is it? The issue is her being able to adapt to a new environment. And you take the overlay for a number of our kids of poverty, unemployment, and violence. And by the way, I don't know if you saw, but the poverty numbers went up again in the nation. I think we now have 46 million people in the United States who fall within the limits of poverty, which clearly underscores the fact that we have a lot of people out of work, and the impact that that has on young people. You know, getting up and sometimes not knowing where the next meal is coming from, or that for so many of our young people, the only meal you get or meals you get are the ones you get at school every day, because you go home to a situation where there's no guarantee of a meal. We have, huge unemployment in the city like there are in big cities across the nation. Our unemployment level right now is about 9.5%. But that belies the reality. In some areas of this city, unemployment is only around 3 or 4%. But go to the eastern end. How many of you all actually work east of the river? How many of you don't? How many of you apparently don't work anywhere? I don't know about this, Steve. Yeah. Well, the reality is when you look at some of our wards in the city, in Ward 5, where we are right now, the unemployment level is 15%. When you look at Ward 7, which is where I live, the unemployment level is 17%. And in Ward 8, where, of course, the hospital is located, which has been for many years the locus of our mental health services, the unemployment level as of today is 25%. 1 out of every 4 people is out of work. And the stressors that creates in the lives of adults, of parents, and then they are superimposed, they are translated, they are imposed on their young people, which then lead our young people who really are ill-equipped at that stage to start to raise questions about their own future. The risk factors, and you know what they are, the risk factors that we need to be cognizant of is exposure to trauma, and so many of our kids are exposed to trauma, especially psychological trauma on a daily basis, violence, incarceration, depression, substance abuse, and lack of social support. And frankly, violence has been a huge issue for us in this city for a number of years. And one of the things I am really pleased with is I look at every day. I look at the crime data in the city. And one of the first things I look at is the homicide data, because that often bespeaks, obviously, where we are as a society, but it also tells us what young people are likely to have as the experience in their life. We are actually on course right now to have the lowest level of homicides in the District of Columbia in over 40 years. And in the month of September, what's today? What is it? 16th. So we're halfway through the month, right? Last September in the city, we had 15 homicides. As of today, as of this morning, we have had in the month of September 1 homicide. And that is a phenomenal step forward. Now, I think we all know what that's going to do for the predictability, if you will, the sense of comfort, the sense of safety, especially in the lives of our children. the number of people here today is incredibly heartwarming because it shows that there is a real recognition of and commitment to the threat of suicide in the lives of our young people. And while we don't have a lot of suicides that we can point to, thank God, the data that I've looked at, the data that you looked at, indicate that 11.5% of the high school students in the District of Columbia, according to, I guess it's a survey that was done, within the last couple of years, probably as a part of this study. 11.5% of the young people who were tested, who were measured, said they had attempted suicide within the high school students within the last 12 months. That is incredibly alarming. And I guess the one thing we can hope for, or be thankful for, is that they actually were not successful. That is twice the national average. But the question we have to ask ourselves is, where are we with respect to knowing who those young people are? Where are we with respect to what we can do to effectively intervene to prevent young people getting to that stage in terms of some of these risk factors that we've talked about? And what can we do to intervene when young people do experience that kind of depression, that kind of sense of hopelessness in their lives, that kind of trauma that leads them to say, the best solution for me is to not be here anymore. And that is hopefully what we'll be able to do. We, as Steve said, we were in the final year of this grant. The question for us now is, what will we do to be able to take what we've learned and replicate it and institutionalize it in our mental health systems across the city? I think one of the most important things, and I've seen it work in so many ways, and that is being able to bring about what I think is the kind of collaborative effort that will have a variety of agencies working effectively together. You know, let me go back to the issue of homicides for a second. There is no single reason why the number of homicides is going down. Certainly we have an incredibly effective police force led by one of the best chiefs in America, and that is Kathy Lanier. And being able to really engage in community policing is an important part of that. One of the things that we instituted earlier this year was the recognition that so much of bureaucracy is vertical management, hierarchical management, and that is, you know, you look at an org chart and you got Steve at the top of it, and then you go down through these various layers, and the way the reward system works is if Steve has finished with Dixon, he checks the box. But what about the obligation to really recognize that people don't work that way? That human beings have mental health challenges, they have physical health challenges, they have employment challenges in their lives, and that people work in a holistic fashion. That is the way they operate. Yet our government structures, not just here but all across the country, typically don't work that way. So one of the things that we've tried to do, which I think is starting to emerge in this effort as well, and that is getting agencies not so much to work like this, but to work like this. And that is, how do you bring the various disciplines together that have an impact on children and getting them to work effectively in collaborative ways? And it shouldn't be just because we have a grant. That's the way we should be organized every day here in this city and across the nation. The school system should be working with CFSA. CFSA should be working with DMH. DMH should be working with DOH. And DOH should be working with DYRS. And yes, I know the alphabet soup just like everybody else. But the fact of the matter is, when we get past, each one of those agencies has a role to play, and oftentimes they are touching the same families and the same children. The family that is on TANF is the one that's seen by the mental health workers, is the one that may have a child or two in foster care in CFSA, a child who may then go on to wind up in the juvenile justice system and be part of DYRS, a family member who's trying to get a job through DOES. And that's the way, if we do nothing else out of this effort, but at the end of the day, say that we've got our agencies working more effectively together, that they are sharing information, and they recognize that there's got to be a holistic approach, we will have made enormous progress. There's nothing new about that concept. We've probably been talking about that concept since dirt was created. The question we have to ask ourselves is, why does it never happen effectively? And that's because, one, the way government is structured, and the reward systems are not such to say that, hey, you know what, if I work in DYRS and I work with CFSA, there's no reward for that. However, if I get my performance plan done, and I get my goals and objectives done within DMH, then I will have been considered to have an effective performance. So one of the things we are working at is exactly what you are working at, and that is, as we tackle the complexity of suicide, how is it that we get agencies working much more effectively across lines? One of the things that I was involved in, and I think there's some representatives here, the Healthy Families, Thriving Communities Collaborative. How many of you are familiar with that? Excellent. I was actually involved in the beginning I've been involved in the beginning of a lot of things. That tells you how long you've been around, right? But back in we did a grant that said, why don't we start looking horizontally at some of these issues, and why don't we try to look at them at the ground level? And that's where the collaboratives came into play. I think we now have 4 or 5 collaboratives across the city, and their job is really to be at the ground level, recognizing the kinds of issues that we're talking about today, recognizing the familial stressors that impose sometimes burdens that kids can't get past, families can't get past in the lives of some folks in some of our communities, and try to work with them at the ground level. And that is the kind of collaboration, whether it's the Healthy Families, collaborative or not, Thriving Communities Collaborative. The concept is the one that we need to work to be able to make work effectively. I understand you're going to roll out a new social marketing campaign. I think that will be great. And by the way, I think we have a pretty good viewership on Channel 16 in the city. Lots of people watch that. And if you wish, I will make sure that we have a very substantial presence of I Make the Difference on Channel 16 so that people get to watch that. So is it ready to roll out now? Yes. All right, well, if it's ready to roll out, Channel 16 will be ready to roll out. And since we have Channel 16 in the back, we know that the message is going to be able to get directly to folks and make it happen. And so I ask that we take what we've learned from this grant effort. Oftentimes, grants become 3-year efforts. They accomplish certain things during the period in which we have funding, but then they just kind of go away after that. What grants really accomplish when they work best is systemic institutional change. And that's what's needed, is systemic institutional change as we address suicide prevention. And prevention is such a difficult thing to sell. When you stand here and say, we didn't have any suicides, this year, sounds like it's not a problem, without recognizing that perhaps the reason why we didn't have any suicides is because of all the work that you all are doing in this year to be able to address the psychological stressors in the lives of our young people. So we're going to take the work that's been done with this grant. We're going to take the work that's been done to create this new social marketing campaign, and we're going to work with Steve and all of you in this room in order to make that happen. And one of the best things that can happen, and I've seen it in my own life, is when you have an advocacy movement that is created and sustained to keep an issue alive. And I hope that there's a significant suicide prevention movement advocacy effort in this city to be able to continue to discuss these issues after this grant is gone. Thank you all very much, and I'll be there to work with you to make this happen.